Here we are with the hip bone, also known as the coaxial bone, also known as the os coxa. This is also known as the pelvic girdle, and I like to think of this as pelvic girdle. It's less bones, more words, because the pelvis requires 2 of these, and so we have 1 of these as the pelvic girdle. 3 bones all fused together. If you take a look at this little structure here, you can imagine this is a big, deep socket in which the femur will rest. This is called the acetabulum. It actually helps us to delineate the 3 different bones that came together, that fused to make this bone. If I were to draw like a Mercedes-Benz sign, you know, one straight down like this, and then one out and one out that way, well, we get the 3, the ilium, ischium, and then the pubis. Pubis being inferior anterior, ischium being posterior inferior, and then the ilium being superior. The reason why I start off with that is because all these markings are named according to these 3 bones, and so you'll hear ischial tuberosity or ilium, iliac crest, or pubic tubercle, and so that's why we start off that way. So clearly, we always do, again, laterality, because we will have 2 of these. And so let's take a look at a couple of the structures. First one is, of course, what we just described, the acetabulum. Very large marking. I like this name called the acetabulum. My wife likes it too. She's like, get your acetabulums over here, both of them, because these are 2 markings that you can kind of describe. And so here's the acetabulum. Formation of all 3. This is always lateral, so I would always put it on my body laterally. And then the other thing is that we have the ilium, the iliac crest. You can imagine this nice fan-shaped structure. The top of it is called the crest of the ilium, so iliac crest. That's always superior. So if I hold it up like this is lateral. The last thing I need to figure out is what side is posterior. If it's this side that's posterior, then this is my left. If it's this side that's posterior, facing that way, then it's my right. And so we take a look at the place where it articulates with the sacrum, and you can see this nice ear-like structure. And it's always faced medially. This is called the auricular surface. Looks like an ear, not to me, but that's okay. Auricular surface, but it is always on the posterior aspect of the bone. So you're going to take this whole chunk and you're going to aim it posteriorly, and then of course this is now my left pelvic girdle. All right, let's walk through some of the other markings that we find. I always think of the iliac crest as like, you know, sun crest over the ocean, and so that's the iliac crest. We already learned that. But if we know this is posterior, the ilium has these 4 spines, and they all, if I kind of hold them like this is the, of course, anterior superior iliac spine. This is the anterior inferior iliac spine. This is the posterior superior iliac spine. This is the posterior inferior iliac spine. So we get those, as well as this big fossa. I always think of somebody, you know, shrink myself down, surfing and stuff like that. This is the iliac fossa, nice shallow depression, place for the iliacus muscle to come and rest in or originate from. And we actually can surf. I always think of a little guy flying through this little surface, always on the medial side, of course, because there's the acetabulum on the lateral side. Medial, and then as soon as you cross this, like as if you were a snowboarder and you like flipped up, woo! This is the pelvic brim, or also known as the arcuate line. So this is the arcuate line, kind of makes this little ridge there. And we find this to help us to make the pelvic brim if we combine this to become a pelvis. Alright, some other structures here, we'll go through these quickly. This hole is the largest foramen in the entire body. It's called the obturator foramen. It's like as if you put your eye here and then you use this as a mask and you're like, I am the obturator! I wouldn't suggest putting human bones on your face, but that's okay. This is a eye, obturator. Somebody's pretty ob to do that. And you can imagine if this is the pubis, well, then we get the superior pubic ramus and the inferior pubic ramus joining with the ischial ramus here. All right, let's take a look at the other structures here. This is the little bump here. This is called the pubic tubercle. And then on the other side is the pubic crest as you come across that. Here's the place where the pubic symphysis, where they would completely join. This is called the symphysial surface, where the pubic symphysis, the cartilage piece that binds these together, would be found. And then on the ilium side, we find a few things. A couple notches. This is the greater sciatic notch. This is the lesser, bordered in between by the ischial spine. This ischial spine, very sharp, you know, that's why we have it, has the pudendal nerve that runs through it. That's why you use it as a good landmark to knock out the perineal floor if you're going to give somebody a episiotomy. So, and then this is the larger ischial tuberosity. Look how rough this stuff is. This is typically where you sit in the origin for the hamstring muscles. So, let's kind of review some of these structures. This is, of course, the pelvic girdle, the left one. We have the ilium, the iliac crest. with the iliac fossa, shallow depression or groove, with the arcuate line being this line, the auricular surface being this ear. We have the four spines, the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, lesser sciatic notch, ischial spine in between. We have the superior pubic ramus, inferior pubic ramus with the ischial ramus coming here, the pubic tubercle, the pubic crest on the other side coming across, acetabulum, all three of them, and then we get this ischial tuberosity and the large hole, the obturator foramen.